My dear viewers, we have Dr. Sridevi, a consultant obstetrician and gynecologist. I'm going to ask her the fluid in the uterus during pregnancy. It's known as amniotic fluid. Can you share some knowledge about this amniotic fluid, Dr. Sridevi?
Yeah, thank you. So this amniotic fluid is very important during pregnancy. So why is this important? What are the functions of this amniotic fluid? So this amniotic fluid allows the baby to move. So there's a freedom of movement and it helps in the growth of the musculoskeletal system. Also, it is very important. It is needed for the development of the gastrointestinal system, that is the GI system we call it, that's the stomach, and also for the lungs. And this is what produces the surfactant which is needed for the baby to breathe. So these are some of the important functions, and also it prevents from any trauma. So these are some of the functions why we need this amniotic fluid. So usually it starts with minimum 50 ml at 12 weeks and gradually it increases, reaching a peak at around 36 weeks where we have 1 liter. So 1 liter is the usual normal amniotic fluid. Again, as the pregnancy after that continues, that is when it crosses 40 weeks, what happens is again the fluid starts to decrease. So this is about normal, and the normal color initially it is colorless, then it becomes straw color, that is there's a pale color. And what are the other abnormalities of this color? Most importantly is the meconium stained liquor, we call that. So that happens is there's a green pea soup like liquor, and this liquor is present in fetal distress. That means the fetus is having some breathing problem. So accordingly, correct actions should be taken. Either the delivery should be conducted immediately, or depending on the cervical dilatation, they have to be taken for a lower segment cesarean section. So that's about the the meconium stained liquor. There are also some other colors. That is, if it is dark brown color, that can be seen in post maturity, that is after 40 weeks, or it is a very dark color then if there is any blood along with it, in concealed accidental hemorrhage, where you call that as antepartum hemorrhage. In that kind of condition it is very dark color. And also sometimes in RH negative it is a yellowish color. So these are some colors. How can we see the color of the liquor? The color of the liquor during labor, if the membranes have not ruptured, then we artificially rupture the membrane. Like when you doubt something, the fetus has a heartbeat, varying heartbeat, that kind of condition, we want to see the color of the liquor. So that time you artificially rupture the membrane to see the color of the liquor. So dependingly the management will vary. Also, as we already said, the liquor, if it is increased in amount, also we should look for a cause, and if it's decreased in amount, that is oligohydramnios, also we should look for the cause.
Yeah, this liquor, as told by Dr. Sridevi, is a very protective function. When the liquor is all right, most of the time the baby is all right. That's why inadvertently you should not rupture the membrane and let out the liquor. Only you are sure you want to decide this woman has to be delivered, then only you rupture the membrane. Until the fluid is there, most of the time the baby and mother is all right. If you rupture, the baby has to be delivered within 12 hours. Because once the membrane ruptured, there is a possibility of infection spreading, and you should not do unnecessary pervaginal examination. The membrane is there, is very safe. Once the membrane ruptures, they have to be careful. That's why necessary, for example, fetal distress, you want to terminate the pregnancy, is a post-datism or blood collecting inside where the placenta separates earlier. These kind of conditions, you rupture the membrane. Okay? Thank you, doctor. Thank you very much.